Let us now go to face reading. The topic is tuberculosis. Pulmonary tuberculosis is a chronic infectious disease resulting from a lung infection with Mycobacterium tuberculosis. When the human body is infected with Mycobacterium tuberculosis, he or she may not necessarily have an immediate onset. The onset only starts when the body's resistance is compromised or a cell-mediated allergic reaction increases. The early symptoms include cough, coughing up phlegm, chest pain, hot flashes, night sweats, and gradual weight loss or loss of strength. In the later stage, the patient may cough up blood. Pulmonary tuberculosis is a result of two factors, internal and external. The external cause is that the lungs are infected with tuberculosis bacteria, and the internal cause is the weakening of the body's vital qi, leading to a decline in the body's resistance. Face reading. The face will be pale and with flushed cheeks, as if rouged. On the ears along zone are red petechiae or small nodules the size of millet grains, which are signs of tuberculosis, as we can see here in this picture. As therapeutic methods, tuberculosis is a chronic disease. Appropriate dietary habits and daily care are very helpful to the patient's recovery. For dietary advice, as tuberculosis is also known as consumption, patients are advised to have a diet with foods high in protein, calories, and vitamins, and low in fat, with a reasonable combination of meat and vegetables. Pears, which can nourish the lungs and dispel phlegm, are a good ingredient for soup or porridge. Exercise. Do low-intensity exercises such as walking and yoga to enhance the respiratory circulation function, promote air exchange, and enhance the body's immunity. For emotional adjustment, tuberculosis patients should maintain an optimistic attitude. If they develop a negative attitude, become paranoid, fearful, and pessimistic, their condition will become worse. Massaging the Shenzhou point or GV12, which connects to the lungs, are responsible for qi, effective in treating such diseases as asthma, coughs, and tuberculosis. Press the GV12 point with the pad of the index finger for 1 to 3 minutes, once daily. Massaging it long-term has the effect of replenishing qi to dispel evil, strengthening the body's resistance, and effectively improving the condition. Thank you so much for your attention.
Let's proceed to interviewing with the fourth and fifth case history of migraine. For a fourth case history, we have a 41-year-old woman who had been suffering from headaches for over 20 years, and they had worsened in the past year. The headaches occurred all over the head and were generally dull in character. Occasionally, they occurred on the left side of her forehead, in which case they were sharp and throbbing in character. She also suffered from chilblains, cold hands and feet, and tiredness, and felt cold in general. Occasionally, she suffered from a visual disturbance consisting in seeing flashing lights. She had 2 children, aged 2 and 6, and she had suffered a heavy blood loss after the second childbirth. Her tongue was slightly pale on the sides and had a hard crack. Her pulse was deep, weak, and choppy. Her diagnosis: there are symptoms and signs of liver blood deficiency manifested by the dull headaches, the visual disturbance, the pale sides of the tongue, and the choppy pulse. This blood deficiency was obviously aggravated by the hemorrhage after the second childbirth, which explains the aggravation of her headaches. Liver blood deficiency in this case has given rise to liver yang rising, which is causing the sharp, throbbing headaches on the left side of the forehead. In addition to this, there are also manifestations of kidney yang deficiency, like feeling cold, cold hands and feet, tiredness, and a deep, weak pulse. In this case, attention should be paid to treating both the root and the manifestation, but with special emphasis on treating the root, that is, nourishing liver blood and tonifying kidney yang. Now let's go to our fifth case history. We have here a 31-year-old boy who had been suffering from headaches, night sweating, weakness and tiredness for 3 weeks. These symptoms had an acute onset in springtime, and before that, his health and energy were good. On closer questioning, his weakness consisted mostly of a feeling of weary limbs. He also complained of an epigastric discomfort, which he found difficult to describe, saying it was like a feeling of hunger, and he could not decide whether it was hunger or pain. This was accompanied by a feeling of nausea. In addition, he experienced aches in the joints, especially of the legs, and dizziness, restless sleep, and irritability. His tongue was very slightly red on the sides and had a sticky white coating. His pulse was slippery, wiry, and rapid with 92 beats per minute. His diagnosis: the essential feature of this boy's condition is its acute onset. If we analyze his symptoms in isolation, many different patterns would emerge. Damp heat in the joints, which are ache in the joints, liver yang rising, manifested by headaches, irritability, and dizziness, yin deficiency, manifested by night sweating, epigastric discomfort with feeling of hunger, spleen deficiency, manifested by weakness, tiredness, and weary limbs, and stomach chi not descending, manifested by nausea. However, if we take the sudden onset into account and consider the symptoms in their totality, it then becomes apparent that this problem is caused by the emergence of latent heat in springtime. In this particular case, latent heat manifests as damp heat. Latent heat occurs when an external pathogenic factor invades the body. In theory, in winter, but it can happen in any season without causing apparent symptoms at the time. The pathogenic factor goes into the interior, turns into heat, and lurks in the interior to emerge later with a sudden onset in springtime. When it emerges, latent heat manifests with symptoms of interior heat but with an acute onset. In this boy's case, the symptoms of heat are insomnia, restless sleep, irritability, night sweating, feeling of hunger, red sides of the tongue, and rapid pulse. The symptoms of damp feet are weary limbs, ache in the joints, sticky tongue coating, and a slippery pulse. Thank you for your attention.
Let us now go to auricular acupuncture. The topic is methods and adverse effects. Methods of auricular acupuncture. The standard needle, as mentioned previously, needling the ear is more painful than needling the body, even when using the same kind of acupuncture needle. Needles are left in the auricle for 15 to 30 minutes to achieve positive results. Overall response is often more effective when employed in combination with concomitant body acupuncture. Pressed needles. These needles can be left in the auricle secured by tape for several days in order to achieve long-lasting effects. Particular attention must be given to cleansing the skin prior to treatment, as there is a higher risk of infection due to the embedding of a foreign body, like the pressed needle, over a long period of time. Acupressure. Although not as effective as needling, acupressure is a useful tool for self-treatment. A small bead is placed on the skin and secured by tape. It is less invasive and presents minimal risk of infection for long-term treatment. Other modalities like electrical stimulation, laser, and ultrasound techniques have also been used effectively on auricular points. Here we can see in figure 8.7 what pressed needles look like. Adverse effects of auricular acupuncture. There are no major adverse effects for auricular acupuncture. Minor effects include minimal hemorrhage or hematoma at the insertion site and increased pain as compared to body acupuncture. Drowsiness and or dizziness may occur following treatment, but the overall incidence of adverse effects is very low. Thank you so much for your attention.
Differential diagnosis for hypochondrial pain. Let's start with Western differentiation. Stemming from liver pathology, we have hepatitis, Chronic hepatitis is characterized by pain with fatigue, lack of appetite, nausea, vomiting. Acute hepatitis will present with pain with headache, enlarged tender liver, chills, fever, malaise, and jaundice. Next is liver cirrhosis. So there will be hypochondrial pain with ascites, swelling of legs, vomiting of blood, confusion, jaundice, small red blood vessels on the skin, weakness, and weight loss. Liver cancer, there is hypochondrial pain with tenderness in the right upper quadrant, enlarged nodules, enlarged abdomen, easy bruising or bleeding, and jaundice. Stemming from gallbladder pathology, we have cholecystitis. Acute is characterized by pain in the right upper quadrant, sensitivity to fats, vomiting, fever. For chronic cholecystitis, there is chronic indigestion, great abdominal pain, nausea, belching. Gallstones, there is pain in the right upper quadrant, sharp cramping or dull may radiate to left shoulder. Fatty food aggravates, clay-colored stools, nausea, vomiting, heartburn, and flatulence. Stemming from stomach and intestinal pathology, gastric ulcer is characterized by abdominal pain, nausea, abdominal indigestion, vomiting, blood, black tarry stools, weight loss, and fatigue. For bleeding duodenal ulcer, there is abdominal pain, nausea, vomiting, indigestion, belching, chest pain, vomiting blood, black tarry stools. Stemming from kidney pathology, we have pyelonephritis and renal colic. For pyelonephritis, there is severe hypochondrial pain, high fever, chills, sweating, vomiting, nausea, frequent painful urination, nocturia, and malaise. For renal colic, there is pain from loin to groin, painful lumbar area or knees, restlessness, vomiting, and pallor. Other causes include intercostal neuralgia, coronary thrombosis, trauma, and liver parasites. Now let's go to Chinese differentiation of hypochondrial pain. Diagnostic questioning according to location of pain. So if it's from the liver and gallbladder, it would be in the right hypochondrium. For spleen, at the left hypochondrium. Nature of pain. Intermittent, acting, or distending pain, difficult to localize, worse for stress. Wiry pulse is liver chi stagnation. Fixed stabbing pain, easy to locate, worse with pressure, worse at night, purple tongue, choppy pulse is liver blood stasis. Continuous severe pain or fullness, worse for pressure, feeling of heaviness, sticky taste, nausea, yellow sclera, dark urine, sticky yellow tongue coat, slippery pulse is damp heat. Slight pain or distension, premenstrual tension, frequent sighing, dizziness, insomnia, tingling limbs, blurred vision, scanty periods is liver blood deficiency. For dull ache relieved by pressure, worse when stressed, dry throat, eyes, hair, tiredness, poor memory, insomnia, depression, scanty periods, dizziness, red tongue, floating pulse, liver plein deficiency. Etiology, emotional strain, there will be anger, resentment, frustration. External damp heat, more common in tropical countries. Poor eating habits, too much phlegm-forming foods such as dairy and fried foods, and overwork. Zangfu patterns, excess, stagnation of liver qi, liver blood stasis, damp heat in the liver, damp heat in the gallbladder. For deficiency patterns, we have liver blood deficiency and liver yin deficiency. Thank you for your attention.
Relationships among Zhang viscera, specifically the spleen and kidney. The spleen is the foundation of acquired constitution, and the kidney is the foundation of innate constitution. The relationship between the spleen and the kidney is demonstrated mainly in the interaction between acquired constitution and innate constitution. Physiologically, the spleen can function well in transportation and transformation only when it is worn by kidney yang. At the same time, maintenance of the abundance of kidney essence depends upon a continual supply of the essential substances transported by the spleen. This relationship is known in Chinese medicine as the innate augments the acquired and the acquired nourishes the innate. In physiology, the spleen and the kidney promote each other, and in pathology, they affect each other. For example, when kidney yang is deficient and unable to warm spleen yang, then spleen yang becomes deficient. Prolonged deficiency of the spleen yang can injure kidney yang. Both can lead to diseases of deficiency of spleen and kidney yang, which is manifested as abdominal distension, cold aversion, lumbar and knee aches and weaknesses, or pre-dawn diarrhea. In this diagram, we see the relationship between the spleen and the kidney. The spleen is a foundation of acquired constitution, while the kidney is a foundation of congenital constitution. They must work with each other to nourish and supplement and nourish the body. Thank you for your attention.
Let's discuss diagnosis according to Sangfu organ patterns. Kidney yin deficiency with empty heat. Kidney yin deficiency heat. In time, kidney yin deficiency will develop into kidney yin deficiency heat. This will happen more quickly if there is already heat present in the body. Symptoms will be the same as when there is kidney yin deficiency, but there will also be more symptoms and signs of heat. We have here the symptoms and signs: the insomnia, dry mucous membranes, dry skin, dry mouth, and throat. Thirst, particularly at night, with a desire to drink in small sips. Night sweats, feeling hot in the evening and at night. Sensations of heat in the palms of the hands, soles of the feet and chest. Hot flashes, malar flush. Tinnitus, poor hearing or deafness. Dry eyes, weak or sore knees. Lumbar weakness or soreness, thin or slender body, aching or pain in the bones, anxiety, constipation, dark scanty urine, poor memory, nocturnal emissions, premature ejaculations. Increased libido, mental anxiety and restlessness, restless or fidgeting body movements, talking quickly or talking a lot, but the voice is not loud, red, thin, and dry tongue that lacks coating, possibly has cracks in the surface, rapid, fine, or empty pulse. The pulse may be relatively weak in the chi positions. Key symptoms: night sweats, hot at night, malar flush, red tongue without coating. Treatment principle is to nourish kidney yin and control heat. Acupuncture points: choose from UB23, UB52, REN4, kidney 1, kidney 2, kidney 3, kidney 6, kidney 7, spleen 6, heart 6, and lung 7. Needle technique is to tonifying except kidney 2, which can be drained. Explanation: UB23, UB52, REN4, kidney 3, and spleen 6 nourish kidney yin. Kidney 1 and kidney 2 control yin deficiency heat. Heart 6 and kidney 7 control night sweats and nourish kidney and heart yin. Lung 7 and kidney 6 in combination open ren mai and yin xiao mai and thereby nourish kidney yin. Kidney yin deficiency heat can be caused by the following pattern: kidney yin deficiency, fire, or heat. Kidney yin deficiency heat can result in the following patterns: liver yin deficiency, heart yin deficiency, heart yin deficiency, stomach yin deficiency, liver blood deficiency, kidney yang deficiency, kidney jing deficiency, phlegm, blood stagnation. For the summary, kidney yin deficiency with empty heat, the etiology: long, chronic illness, overwork, over long period, excessive sexual activity, depletion of body fluids, blood loss. Underlying accompanying pathology, there is kidney essence deficiency, kidney yin deficiency. For the signs and symptoms, there is dizziness, tinnitus, vertigo, poor memory, hardness of hearing, night sweating, dry mouth, throat at night, 5 palm heat, feeling of heat in the evening, malar flush, menopausal flushes, thirst with desire to drink small sips, lower backache, ache in the bones, nocturnal emission, constipation, scanty dark urine, infertility, premature ejaculation, tiredness, lassitude, depression, anxiety, insomnia, excessive menstrual bleeding. The pulse is floating, empty, rapid. The tongue is red, peeled. There can be cracks. Treatment principle enriched kidney yin and clear empty heat. For the acupuncture treatment, we use REN4, which supplements kidney yin and essence. Kidney 6 supplements kidney yin. Kidney 9 regulates qi and alleviates pain. REN7 benefits lower burner and genitals. Heart 6 clears empty heat, stop night sweats. Lung 7 with kidney 6 open REN vessel. Kidney 3 supplements kidney yin and essence. Kidney 10 benefits kidney. Spleen 6 supplements yin. Kidney 2 clears empty heat. So we needle with supplementation. Thank you for your attention.
We continue with the pericardium in mental emotional problems. The pericardium houses the mind with the heart, and its pathology includes the following. Blood deficiency of the pericardium will cause depression and slight anxiety. Blood heat of the pericardium will cause anxiety, insomnia, and agitation. Phlegm in the pericardium will cause mental confusion and, in severe cases, mental illness. The pericardium affects emotional problems derived from relationship problems. The minister fire is the fire of the gate of life, Mingmen. As we have seen, this fire is essential to the healthy functioning of the body. Although many doctors, such as Zhu Zhenhang, identified minister fire with the fire of the gate of life, and therefore the kidneys, others, such as Zhang Qiepin, identified the minister fire with such internal organs as the kidney, liver, triple burner, gallbladder, and pericardium. Thus, purely from a five-element perspective, the pericardium pertains to the minister fire with the triple burner compared to the emperor fire of the heart, while from the perspective of the internal organs, the minister fire is the fire of the gate of life pertaining to the kidneys. However, there is a connection between the two views, as the minister fire of the kidneys does flow up to the liver, gallbladder, and pericardium. In pathology, this has an even greater relevance, as the pathological minister fire of the kidneys, driven by emotional stress, flares upwards to harass the pericardium, causing mental restlessness, agitation, anxiety, and insomnia. Indeed, the minister fire and the original qi are said to emerge from between the kidneys through the intermediary of the triple burner. It is not by chance that the back transporting point of the triple burner is on the back at bladder 22, one vertebral space above the back transporting point of the kidneys, bladder 23, and the point 24. Indeed, it reflects the fact that the minister fire emerges from the space between the kidneys through the triple burner. So we have here the minister fire and original qi that emerged through the triple burners. So the original qi minister fire, then we have the triple burner, which will definitely affect the organs. So here we could see that the bladder 22 is situated just on top of bladder 23 and 24. The minister fire of the kidneys is said to go upwards to the liver, gallbladder, and pericardium. The minister fire going up is compared to the fire dragon flying to the top of a high mountain, and that going down to the kidneys is compared to the fire dragon immersing in the deep sea. The fact that the minister fire of the kidneys flows up to the pericardium could explain the assignment of this organ to minister fire in the five-element relationships. So here we have the relationship between minister fire of the kidneys and the pericardium. So the minister fire will flow down to the kidneys, or it can flare up to the liver, gallbladder, and pericardium. So here we can see that the minister fire flowing up to the liver, gallbladder, and pericardium down to the kidneys, assuming the dragon. So we have the fire dragon flying to the top of a high mountain. For the minister fire that goes up, that flares upward to the liver, gallbladder, and pericardium. And we have the fire dragon immersing in the deep sea for the minister fire that flows down to the kidneys. Thank you very much for your attention.